Okay, so we are here in Lyon during the 23rd Congress of the International Association of Parkinsonism and Related Disorder. So we had just this morning a beautiful session about new treatment and new perspective how to deal with the patients with the Parkinson disease. So I think that the feeling of the expert community concerning this field is certainly that we need to move forward more trials and more discovery about neuroprotection in this field. Because now we know that this disease starts several years before the onset of the motor symptoms. So when probably we start all the treatment is too late to prevent our patients to worsen their symptoms. And I think the most important needs are also to develop new treatment, and we will discuss later about that, to prevent the most disabling symptom or to mitigate the most disabling symptoms of the disease. It was also a very interesting lecture done yesterday about to intervene. You know, we have several phases of the disease. We have the prodromal phase, we have the preclinical phase, and then the clinical phase of the disease. To start with the first prevention. So when you are completely healthy, to start to prevent the possible prodromal phase of the disease. So very, very earlier in the course of your life with, for example, exercise, with a healthy diet, with a healthy style of life that potentially can prevent neurodegenerative disorders, not only Parkinson's disease, which is the second most degenerative disorder, but also Alzheimer's disease, which is the first neurodegenerative disorders in the world. Okay, this is a very difficult question because, as everybody knows, axial signs, which are gait issues, balance issues, and speech issues, belong to the advanced phase of the disease. So usually in these advanced phases, the classical treatments that we use for treating the other symptoms of Parkinson's disease, namely levodopa, they work much less on these axial signs. So we try to do our best, we try to combine treatments. We use also surgery, the brain stimulation, namely for treating some of these aspects, but usually because they lose the benefit to levodopa, we have to find other ways. So I think there's increasing evidence that re-education, rehabilitation, exercise can actually help quite a lot our patients to reduce the number, for example, of freezing and above all of falls. They induce fracture of most of the time the lower limbs, and then they require hospitalization and surgery. So I think that definitely now rehabilitation and exercise are very important in the armamentarium of our treatment for Parkinson's disease.